Thanks very much. Welcome, folks. It's great to have you out this evening. It's great to be back in Halifax, Dartmouth. And I was lucky enough to be up in the Annapolis Valley today, up near Chris's place, to South Breck, and it was beautiful and sunny, and had a great look out over the basin. So, I am, of course, part of the National CCSVI Society. And the reason we created that society roughly a year ago is chronic cerebrospinal venous insufficiency is probably a key piece of many neurodegenerative illnesses. And, you know, it's 15 years since I've been diagnosed with multiple sclerosis. That's one of them. But another one is Lyme disease. Another one would be Parkinson's, Alzheimer's, the whole host of things, which we've had no answers for. And it's very exciting to have a different concept. So when we think about venous problems, the problem is relative blockage of the venous blood leaving the brain and spinal cord. And even a modest blockage makes a difference because it creates a back pressure, even a hypertension inside the head. We also know now that the blood takes 2 to 3 times as long to get from the heart to the brain and back to the lungs for fresh oxygen. So it's not accidental I wear this particular outfit. The red tie represents freshly oxygenated blood from the lungs, goes from the heart to the carotids, up to the brain and spinal cord. There, ordinarily, it should just be a short time, delivers oxygen, and becomes slightly darker, and that would represent the shirt, so it's sort of a dark red. But if it takes too long to get through that part of the brain, there's more and more oxygen taken out of it because the tissues are screaming for oxygen. The brain uses a quarter of the oxygen supplied by the body, a huge amount. Then the blood gets dark blue. So you end up with parts of the brain short of oxygen. So that's why I want you to think about, and this is a piece that we've missed in medicine for a very long time. It's probably the most important thing we've figured out in my lifetime. And I'm 58. So it's a matter of moving forward from there. The other part, I still see some patients in consultation. I follow a couple of patients with chronic Lyme disease. At least one of them's been treated already. Made a significant difference. But from my understanding of the Borrelia spirochete, you'll learn a lot more from Dr. Murakami. I was really fortunate. A group of us met earlier today and learned a lot from each other. But the Borrelia spirochete does prefer areas with minimal amounts of oxygen. So one of my pet theories or ideas is that those of us with Lyme disease that have poor oxygen availability in the brain are more likely to get severe problems with neurologic Lyme. Okay? So I want you to go with those premises because it starts to tie everything together. And it's the same reason I've got a few cards, the National CCSVI Society, because that's why those different colors are represented there. Okay? Remember? And as soon as you open up the veins draining the brain, the spinal cord, so that's the 2 jugular veins in the neck, right beside the carotid where you check your pulse. Don't check both carotids at the same time. You get quite faint usually. And then the azygos vein, which runs down in front of the spinal cord. Those 3 do most of the drainage. And those are the ones virtually always we treat, and you'll get more from that specifically from Dr. Rao. And you can follow our website for any number of choices. On November 21st, if you go to the website, nationalccSVIsociety.org, or get one of the cards, then it's the 2-year anniversary of the W5 program. Okay? Talking about Dr. Zamboni, his discovery, and the treatment of some people. Those were initially were in the United States, actually. Okay? And so there will be a 36-hour ongoing patients and physicians talking about the whole gamut, which will be online November 21st. Okay? So that's coming up soon. It's kind of a worldwide forum. In addition there, you can get the 5-hour, 3 DVD set, which we did at the first ever Canadian CCSVI Forum, which we had in Victoria, BC, just a short 8,000 kilometers away. On the other coast, the wet coast, well, sometimes yours is wet too. And that's 9 speakers, including not just myself and Dr. Rada, but 7 other speakers talking about a wide gamut of issues related to CCSVI. So that includes even a dental impact and a medical impact, how we might treat it with certain other things. Tonight I'm going to focus primarily on coagulation, because a lot of work been done by Dr. Danielle Robitaille, who's at the Institute of Cardiology, University of Montreal, Okay, so what is restenosis? It can be a number of things. You'll hear more about valves when you hear from Dr. Rada. It could be the valve that's been expanded with the balloon. It could be collapsing down again or retracting. So that would narrow things down. And it's one of the possibilities if you're having something happening in the first few days or first few weeks and months after having your venous angioplasty. I try not to go near liberation because too many people think it means cure, and I'm talking symptom control of CCSVI symptoms. They aren't exactly the same as MS symptoms, they're not exactly the same as chronic Lyme symptoms, but there is some crossover between them. It could be a clot. And even in the last 2 weeks, 4 people that had their 2 weeks of anticoagulant therapy, then they got all their symptoms back, which is the biggest clue that there's something going awry. We put them back on anticoagulant, and within 2 or 3 days, they resolved again. So that is probably a clot. And so now the protocols have changed. What you don't want is the clot to be there long term, because the body doesn't like a clot long term. It fills it in with fibrous tissue. That's a lot harder to clean up. And it could be external changes. Some of us, have a bony prominence that pushes in on the vein. So as I talked about, it's the return of symptoms that seem to improve from your procedure. Okay? Although you want to rule out some other exacerbating or worsening issue, such as a urinary tract infection or bladder infection, any other infection, major stress. I mean, if you lose your dad or your mom 3 days after your procedure, you get worse, it could be the huge stress of losing the loved one. So, if you get signs of restenosis, well, you can do ultrasound. You folks aren't any much better off than I am in Vancouver Island getting ultrasound. I mean, you could get yourself off to Barrie, Ontario, above Toronto, or you get yourself off to Montreal. Ultrasound has its troubles. Ultrasound is very observer dependent. So if someone goes in with blinkers on, sure that they're not going to find anything, they probably won't. Okay? So they need to be well trained, and they need to be extremely good at what they do. So that's why I prefer MRI, MRV confirmation with an important flow protocol. And the favorite one, I think, and probably will become the standard in the industry, will be the Hakey protocol, named after Mark Hakey, a Toronto-born physicist who works out of Wayne State, Detroit, not too far from you folks. And he also works a little bit at McMaster University in Ontario. Or occasionally to look at the azygous vein, because you cannot see the azygous vein with ultrasound at all because of where it is. Then you'll sometimes do a CT scan, or some of you know it as a CAT scan. It's not the neighborhood cat being an X-ray, as some people think. With dye confirmation, because sometimes that will show what's happening. And then eventually we may get to the stage that we can look at optic changes. That bright picture they take at the back of your eye, eventually we might be able to use that. But we're not there yet. You can go in and see your optometrist, and most of them won't be there. So how do you prevent restenosis?